This is Dr. Fazeli. I'm a geriatrician in Southern Maine, and I'm recording this video for my nursing home and assisted living colleagues around cloth masks and their use in lieu of surgical masks during the time of shortage. The reason we're having the discussion now is number one, the surge in new cases of COVID-19 in the United States. And also the fact that many, if not all, Southern Maine hospitals are now having confirmed cases of COVID-19, and many of them have multiple cases. We also had a case in Southern Maine in one of the nursing homes in Saco that was reported on yesterday. So we are in an environment where we still can have seeding of the infection to the nursing homes despite the lockdown. Our staff still go home every day and they are interacting with the community, albeit at a limited level, but there are carriers in the community. There's also new admissions coming in from those hospitals who have positive cases. So there's a chance of exposure even if the person is asymptomatic. And we do not have the protective equipment to quarantine all admissions for 2 weeks or test them more liberally if they don't have any symptoms yet. So that coupled with a few visitors that are still allowed to come in for palliative reasons, if people are dying of natural causes, we still have a few visitors who can still bring us that disease. So we need to start that discussion about what to do to protect the nursing homes from the surge of cases. So we started by asking two questions. Do we have enough inventory of surgical masks to meet the needs of the next 2 weeks of the current rate of use? And the other critical question was, what would we do if we had a case today? And we realized that if we had a case today, we would automatically be masking everybody. But sadly, at that point, it would be too late because that case that we discovered today in a nursing home would have sat there for 2 weeks, up to 2 weeks. So at a minimum, a few days, up to 2 weeks of silent exposure to an exponential exposure of other people. So if you mask your staff at the point of a positive case, then you're doing it too late. Keeping that in mind, I'm making the decision now for my facilities to use what available masks there are to bridge the gap until we get the supply of surgical masks to the level that we need it. And that doesn't mean we're going to be using cloth masks for everybody at all times. We have carved exceptions for the following. Anyone with isolation, we're going to continue our current protocol of disposing of all used masks each time we go to the room. So those cases are the highest risk cases, and we cannot afford to carry the virus with us to other rooms. We also are carving exceptions for people who have exposure issues, anybody who has symptoms. We are testing, but we are also having tiers for the people who pose the highest risk for exposure of others. And I can answer more details about that, but I don't want to spend a lot of time on this exceptions issue. You should just know that whatever you're isolating and whomever you're afraid may be exposed are not the ones you're going to use cloth masks on. This is a mandatory masking for all staff with very few exceptions. So the exception that we carved out is the kitchen staff while they're in the kitchen because of the high humidity level and the issue with moist cloth masks being more harmful than useful. So if you have enough surgical masks, you don't have to do anything different. You just need to know what you are going to be using the next 2 weeks. We've ordered masks. We have not received any emergency supplies so far. I don't know if you have, but based on those supplies, you can decide how critical your shortage is. And if it's critical and you're not able to mask people now, you should mask them with a cloth mask, or at least consider it. If we have a gap of not doing anything for the next week while everything around us is surging, we run the risk of having cases, and by then it's too late. So a few things about the cloth mask that you should know is, number one, there's inconsistency in material. So you really don't know what you're getting depending on the source because they're homemade. Then there's ample evidence that shows that they're inferior to surgical masks, and the percentage varies. But you cannot have a false sense of security and complacency once you use them and say, you know, I don't have to worry about contracting the virus anymore. You still have to be doing what you're doing now, monitoring, screening, being vigilant with residents and staff, and making sure that people are not using cloth masks in infected rooms, in isolation rooms. Or if somebody had exposure and you're waiting for their test, or you're just waiting if they have symptoms, they need to be wearing surgical masks. So let's be clear, surgical masks are superior, are your first line of defense. They're not to be replaced with cloth masks unless you don't have enough. And hopefully this is a temporary measure when you do it, and it's gonna be moot once you take delivery of supplies. The issue I wanna mention also is the social distancing in nursing homes. So we've had people bring that up who are not working in nursing home setting, an assisted living setting. So I really wanna touch on that so that you can have a ready answer, or I'm sure many of you do, but just to add to that. So in my opinion, the two reasons we're having challenges in nursing homes with social distancing is the dementia and the fact that most people are hard of hearing. Even if you're not providing hands-on care, you cannot stand 6 feet away from a patient or a resident and then expect them to hear you. And then if you're gonna remove your mask and shout, that's gonna defeat the purpose. So for all intents and purposes, we are not able to do what everybody else does, including the hospitals. Dementia patients, not only are they not able to stay in their room, they also wander in other people's room. So we're lucky if they wander in the hallways only. I've been practicing modified social distancing while I take care of these patients. For example, telling them to turn away while I examine them. When I do the interview, I sit away as far away as I can based on their level of hearing. But so if you're telling your staff, emphasizing social distancing, in that setting, it may be an unachievable goal that's going to distract from more achievable goals, like maintaining masking. One last item of discussion in general is our community needs to be aware of our challenges. So we can't expect support or empathy or sympathy if we're suffering in silence. A lot of the community comments that I see on Twitter, comments on articles on the Portland Herald, etc., seem to indicate that some Mainers think we are trying to hoard supplies, that we are not empathetic to the need of harder hit areas. Nothing can be further from the truth. We want the bare minimum. And for the last 2-3 weeks, we haven't received any shipment of supplies from vendors or from FEMA, as far as I can tell. And if anybody received it, nobody's telling us. So there needs to be transparency on all sides, including ourselves. So we need to tell people how much we have, and if you share your information with organizations like Maine Health Care Association, maybe they can advocate for you. Also, if we get shipments to the state and we are asked where are they needed most. Currently, we know everybody has masks in the hundreds, not in the thousands in each facility. So we need to know who has them and how much they have so that we can prioritize. So we're not hoarding anything. And even when we're asking for viral swabs, facilities are only asking for 5 and 10 at a time, being sensitive to the need of others in other states and harder hit areas. But we can't do that at the expense of our residents and our patients. So we need the bare minimum to be understood by our community. We don't want mass testing in nursing homes. We just want to test the symptomatic patients. We don't want mass testing for admissions until it's more available, but at least we want testing for people who are symptomatic. So that's not too much to ask for, and it's not too much to ask for the government to tell us how many masks they're sending and when. If they're not telling us this and they work for us, there's a problem here. And somebody needs to get that information and disseminate it. That's it. Stay safe and thank you for your service.